Hello and welcome to this episode of USMLE Step 1 Concepts. So today we will discuss the chronic granulomatous disease from a microbiology point of view. So I think first of all, to understand the mechanism of this disease, we need to understand something called oxygen-dependent killing mechanism of neutrophils. Okay, so we'll erase this. Now we have oxygen-dependent killing mechanism of neutrophil. So now we have here a neutrophil. Okay. So what does neutrophil do? It engulfs bacteria, then creates something called phagosome, and then it kills the bacteria inside or kills the microorganism inside the phagosome using oxygen-free radicals. Actually, the neutrophil create oxygen-free radicals from oxygen using two main enzymes. So the first enzyme called NADPH oxidase, and the second enzyme called myeloperoxidase. Okay. NADPH oxidase converts oxygen to superoxide. Superoxide is bactericidal and can kill the bacteria. Myeloperoxidase converts hydrogen peroxide into something called hypochlorous acid. And hypochlorous acid is bactericidal as well. So now what will happen in chronic granulomatous disease? In chronic granulomatous disease, there is deficiency in NADPH oxidase enzyme. So this pathway will be completely knocked off. So in this case, the neutrophil relies mainly on myeloperoxidase to kill the microorganism. Okay, imagine that we have certain organism that produce catalase enzyme. So we call this organism catalase positive organism. So catalase can convert hydrogen peroxide into water and oxygen. So in this case, myeloperoxidase will be useless. Why? Because catalase convert the substrate that myeloperoxidase works on into water and oxygen. So in this case, the only organism that can survive inside the neutrophils without being killed is catalase positive organism. So the presentation of chronic granulomatous disease will have recurrent infection with catalase positive organism plus granuloma formation. Okay, so now the second question is, we would like to know what are the catalase positive organism. There's a very nice mnemonic that we can use to remind us with the most important catalase positive bacteria. Okay, we can retrieve this mnemonic from the action of catalase. So catalase enzyme converts hydrogen peroxide into water and oxygen. Okay, so imagine that there is a water on the floor. What will happen? The floor will be slippery. So slippery, this is the word. So we have here slippery. Okay, so S stands for staph, Li stand for Listeria monocytogenes, P stands for Pseudomonas, okay, so Pseudomonas, E stands for Escherichia coli. So these four are the most important catalase positive bacteria. Of course that there are many catalase positive bacteria, but at least we can remember these four as the most important catalase positive bacteria. Are there any other organisms apart from bacteria which are catalase positive? The answer is yes. So we have fungi which are catalase positive. But I don't think that we need mnemonic to remember them because they are very easy. We have two organisms. We have Candida and we have Aspergillus. So we have Candida and we have Aspergillus. So now, just to recap, in oxygen killing mechanism that used by neutrophils, we have NAD, pH oxidase, okay, and here we have myeloperoxidase. In chronic granulomatous disease, we don't have NAD pH, so the neutrophil relies mainly on myeloperoxidase. In case of catalase positive infection, myeloperoxidase will be ineffective because catalase can convert hydrogen peroxide, which is the substrate that myeloperoxidase works on, into water. And we use water on the floor, and the floor is slippery as mnemonic to remind us with the main or the most important catalase positive bacteria. So I think now the concept is clear. What we will do next time, we will discuss the difference between competitive and non-competitive inhibitor, and also we will mention briefly the difference between Emax and ED50. Okay, I'll see you guys next week. Bye.